Before conducting dysphagia screening, do not feed the patients when they are lying down. The best position is sitting upright on a chair, wheelchair, or hospital bed. But if it not achievable, position them at 45 degrees in a reclining position. Other than that, please provide back support such as pillow if needed. Before conducting the dysphagia screening, make sure the head is facing forward. Avoid tilting the patient's head backward, as it can increase the chance of penetration or aspiration. The components of the dysphagia screening are following from unpublished study conducted by Shobha Sharma and Rahaya Mustafa Kamal. It comprises of 3 sections that are needed to be completed. During screening, mark as normal if patients can execute all tasks correctly. On the other hand, mark as abnormal if patients could not do the task, or there is a changes of voice quality after swallowing is perceived. In the section A, you are required to begin the screening of the patient's alertness and consciousness. Then, it is followed by screening the comprehension skills. Next, screen the hygiene of the patient's oral cavity. Lastly, check the presence of oral sore or ulcer within the oral cavity. After that, screen the patient's oromotor strength and movement, which involving lips, jaw and tongue. Next, feel the laryngeal elevation of the patients when swallowing, by resting your finger on the laryngeal sling. Lastly, screen the patient's ability to cough and clearing throat. In section B, make sure the patient is seated in an upright position. Then, give water to drink, with 1 teaspoon at a time. Make sure to ask patient to produce after each intake. Stop immediately and mark as abnormal if there is changes of voice quality, coughing or drooling is observed. In section C, administer this section at least 2 minutes after you have completed, or need to stop at section B. Have them say prolonged and check of the changes in the voice quality. Lastly, mark the result as abnormal if changes of voice quality is perceived.